September is Suicide Prevention Awareness Month, and a big part of awareness is normalizing the conversation about suicide.
The JED Foundation for Emotional Health says knowing how to discuss and respond to the topic can save lives. ABC's Morgan Norwood tells us how.
Approaching the subject of suicide with a loved one is a delicate situation, and even though it can be difficult, Dr. Katie Hurley of the JED Foundation says a common concern that asking about it may end up causing it in some way is just not true.
Asking about it actually opens the door to conversation, and people are generally relieved that they have an opening to talk about something that's difficult to talk about, and it's not going to put the idea in somebody's head.
Hurley says there's no perfect time to ask, but an atmosphere that maximizes privacy and minimizes potential interruptions is best.
Creating a calm and brave space to speak to another person. So really putting away our technology, calming our own nervous system.
Start by expressing your concern and desire to help, and then don't beat around the bush.
You want to use the word suicide and say, are you having thoughts of suicide? Are you thinking about suicide? It's okay to use that very direct language. And in fact, that gives the other person a chance to really say what's on their mind.
Hurley says that if a loved one is thinking about suicide, stay calm. Thinking about suicide doesn't necessarily mean they're planning to act on those thoughts. Throughout the conversation, be an active listener and validate their feelings.
So instead of, but you have so much to live for, what you want to say is, this sounds really hard. I'm so glad you told me this. Or instead of, but you should be grateful for all the wonderful things in your life, you should respond with, I'm sorry you've been going through this alone. I'm here for you.
Connect them with help, such as the Suicide and Crisis Lifeline at 988. You can offer to be on that call with them for extra support. Hurley says to avoid promising to keep someone's suicidal thoughts a secret. Instead, promise to keep helping until they feel supported. Morgan Norwood, ABC News, New York.